Alzheimer's disease is the most common cause of dementia among adults ages 65 and older, impacting millions of Americans. However, mild cognitive impairment, the earliest stage of AD, is often not diagnosed in a timely manner. In fact, approximately 1/3 of the people living with mild cognitive impairment will develop dementia due to Alzheimer's disease within 5 years. With treatments available that now address the underlying disease, early diagnosis can bring hope for patients like Doyle Scott. And Doyle is here today with his dementia care specialist, Dr. Yogesh Shah. Together, they'll discuss their experience with early Alzheimer's disease, including the importance of early diagnosis and treatment. Doyle, Dr. Shah, thanks for joining us today.
Thank you. Thank you for having us. We are happy to partner with ASI and Biogen to talk about this disease. I'm here with my patient and my friend now, Doyle, to share the LEQEMBI journey with you all. When we talk about early Alzheimer's disease, it's referred to as mild cognitive impairment, or MCI, and mild dementia due to Alzheimer's disease, which is different than normal aging. In normal aging, people tend to occasionally forget names, but with early AD, it affects their life in the sense of they might not be able to cook properly or might not be able to do finance properly. So Doyle will share his journey with both, and then we'll talk about how LEQEMBI works.
Okay, thank you. I had trouble staying organized and on schedule, which was uncharacteristic for me. I'd had a successful career as a principal, as a teacher, and as a superintendent. And I knew, my wife and I both knew that I was having trouble remembering things and staying on task. We visited with our doctor, who then referred us to Dr. Shah, who then confirmed my early Alzheimer's disease diagnosis and started me on LEQEMBI. I'm glad to be on LEQEMBI, which helps me to continue to do the things that I enjoy doing. Now, since starting LEQEMBI, I've not seen any appreciable decline. I continue to see Dr. Shah, and I'm thankful to still be golfing. I do reading. I teach Sunday school class. I travel. I also enjoy doing things that I hadn't done for a while and hadn't been able to do while I was before I was on LEQEMBI. Now, these have been my results, but everyone is different.
So let me share with you some of the side effects of LEQEMBI and then see how to look at them. So LEQEMBI has serious side effects. One of them is known as ARIA, amyloid-related imaging abnormalities, or ARIA. A very small group of patients can have allergic reaction, and then small group of patients can have infusion-related reactions, or IRR. ARIA stands for amyloid-related imaging abnormality. It causes swelling, temporary swelling in the brain, which disappears in most of the patients, and there might be few other side effects. Patients can get more information about LEQEMBI through the website, which stands for leqembi.com, leqembi.com, for not only the side effects, but also who are the right patients, when to get information, and information for their care partners. Thank you.